And you're veteran now, you know. Okay. How was your day?
Not too bad. How about you?
Yeah, I'm good. Well, with you, I'm having a jolly good time. Yeah. Okay, go ahead.
Wonderful. So, good morning, good morning, good morning, and welcome to another episode of Health Vibes from Jolly's Pharmacy, the brand that you trust. So, we are already the 3rd of December, and we are seeing many companies, many homes putting up decorations, getting ready for the season. And definitely, we are of no exception at Jolly's Pharmacy. But this morning, Trudy will not be in with us. Good morning to you, Trudy, if you are listening to us. With me today is Leona. So it will be two of us in this morning. So we really want to welcome all the listeners, all those who consistently join us on our Facebook Live page. Good morning to you, Lee.
Good morning, Jacinta. And we're happy here today, as she said, to bring you a bit of vibes and information this morning. And so there's a lot going on during the Christmas or the holiday season.
I'm having a little difficulty. So you got to come. Yes, your microphone. You get a little closer to your microphone.
I hope everybody can
Yeah,
hear
you're
me.
sounding distant. Yes.
Indeed. So we're having
That's
a lot
better.
of celebration at Jolly's Pharmacy as well. And I hope that you do have a lot planned out for yourself and your family. Again, like we said last week, Christmas or the holiday season, December season is about family and togetherness. Besides the commercial aspect of it, we're gearing up towards, gatherings and love and shows of support and care. So for our Jolly's family, and of course the wider family which you are all a part of, we will be having our annual event, Jolly's Megaland. And we said that last week and we're saying it again this week for you so that you know all the details and you take the kids down to Megaland. And so Megaland this year will be held at Portsmouth this weekend on Saturday, and it begins at 2 p.m. all the way to 6 p.m. So you can take your children along with you. And of course, the adults come there, come and socialize. And, there'll be, one, two things for you to do as well. We'll have bouncing castles, we'll have snacks and treats and games and some fun things that the children can enjoy all for free down at Megaland. So this weekend, it's all about the North in Portsmouth. And next weekend, we will be at JP Mega in Fockley. So be sure to put that in your schedule and make time for those celebrations.
Right. So well said, Leona. We are starting off the season with a bang, with excitement, with fun for both children and adults. So put it into your schedule that for this weekend in the north and next weekend at Focally, where we are gathering to have a bit of Christmas love and fun. So this morning's program, we are focusing on HIV and AIDS. We were supposed to have two guests in studio with us this morning. Unfortunately, they were not able to come, but we have all the information that you need. So tell a friend to tune in as we speak about HIV and AIDS. We will take a short break, and when we return, we will start our discussion.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts Trudy Kristen and co-host pharmacist Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Back to you. Yes, absolutely.
So good morning, everyone. As Jacinta said, today we'll be focusing on HIV and AIDS, right? And this is something that we should all know. And if we don't know, definitely take a listen and understand how important this is to the general population. So on December 1st, we celebrated World AIDS Day.
Yes.
And this is why we're so focused on this topic this week. So World AIDS Day is about awareness, and it brings awareness, of course, to HIV and AIDS. And we'll go into the differences for you a bit later. But to let you know what's going on in the world right now, I'm going to go into the general theme for World AIDS Day. So for World AIDS Day 2025, the theme is centered around overcoming disruption, transforming the AIDS response. Now, it sounds a bit complicated, but what this basically means is that our global community stands at a moment of both possibility and peril. And that's in the reference of HIV and AIDS. What we want to do is we have had decades of progress, and that means that the world has developed the tools, the experience to end AIDS as a public health threat. Of course, all these gains that we have, they are unfolding amid tightening financial situations, conflict all over the world, climate shocks, and of course, widening inequality. And this is things that I am taking directly from the United Nations. So that is how relevant it is. So we have all of these external factors that are affecting how well we can get to our goals when it comes to AIDS. And I'll talk about what that is in a moment. But we have all these external factors. So this is the disruption that it talks about. And of course, what we want to do is, despite this disruption, we aim to overcome it and then transform our AIDS response into a place that goes in line with the 2030 AIDS goals, right? And now the target that we had before was to end the stigma, discrimination, and gender-based violence and inequalities, as well as the punitive laws that block the access to HIV prevention, treatment, and care. Now, we have gone on to adopt the goals of 2030, which are just 5 years away. And with those 5-year goals, and some countries are closer to it than others, but with those 5-year away goals, we hope to end, AIDS as a threat globally in 5 years. Now, it sounds really short, doesn't it, Jacinta?
Yes, it is very short when you think about it. Time goes by very quickly. But as the theme explains itself, we are trying to overcome disruption. And Leona listed the various challenges that the world faces. So it's not just in one region, it's not in just one country, but it is a worldwide health threat. And so this is why every year on the 1st of December is World AIDS Day, where we try to increase the awareness, the information, the education that we disseminate to everyone so that they are well informed. They are better able to make more safer options sexually for themselves, for their loved ones, and for their future.
Indeed.
Because as we go through our discussion and distinguishing between HIV and the progression to AIDS and how we can, mitigate the spread of it, the challenges, and the death rate, reducing that for sure, we will understand more and more why we have to take our health into our hands. And the sexual health, although we may not speak about it as often as we should, but it is a very big aspect of our lives, and so we should not ignore that fact. So we will go into the definition and the difference between HIV and AIDS and how it can progress. HIV can progress to AIDS and how this can be prevented. So HIV, as we know, is a human immunodeficiency syndrome. Virus. So HIV, human immunodeficiency virus. And this is a virus where it affects the body, the immune system. It destroys a certain type of cells in the body called CD4 cells. And those cells are very crucial for immune response. So when someone has been diagnosed with HIV, you are looking for a certain viral load in the body of that certain type of virus. And so the aim is to slow the progression towards acquiring AIDS. Now, with AIDS, this is where the viral load of the HIV virus is either reaches below 200 centimeters per millimeter cube. So it's just a concentration that they look for when they do rapid testing. So at that point, then that person would be diagnosed with AIDS. But the goal is to reduce or slow the progression of this virus before it reaches that stage.
Right, and definitely. So,
Mm.
as you can tell from that definition, it's two different things. Now, it's caused by the same virus, that is the HIV virus, right? HIV. Now, at this point, when we get to AIDS, this is where you will notice some of the more concerning signs and symptoms. So, it is that you can have HIV for years and not have AIDS, right? It is that you can live a full life with HIV and never develop AIDS, right?
Right.
So that's especially with good treatment. Now, when we're talking about AIDS, this is something where more than likely either for whatever reason it is, because sometimes stigma can also block the idea of testing, or maybe you just never understood what testing was, or again, our sexual habits, all of these things that put you more at risk, and you acquire HIV. If it's untreated, or if for some reason treatment is not effective, right? So your count of these HIV, the infections or the cells, your CD4 count drops very low. And what that is when we talk about the CD4 cells and we talk about the immune system, if your immune system is no longer functioning, then at this point, what does this mean? It means that any, opportunistic infection can then occur. So normally, we're working every day, we have children, and why is it that we're not sick every single day of our lives? It's because our immune system often protects us from a lot of minor infections, and it also attacks, major infections, all of these things. Sometimes we get sick and we need added help, so we might need antibiotics, antivirals, whatever the case may be. However, usually a great functioning immune system does the job against minor infections. When you have HIV and your immune system is now suppressed, and you don't have that many CD4 cells within your body, any little infection can then become a very major thing. And when we talk about drugs like antibiotics, if you don't have an immune system, then antibiotics are not effective, because what it does is aids the immune system, right? So if then we have that disruption, we contract maybe say a common virus like a cold, and at this point, your body cannot deal with it. It develops into the pneumonia, and with the pneumonia, you're getting treated, but your body is already compromised. And at this point, this can develop into something like death, right? And this is how we see persons most times dying from AIDS at this point. It's more than likely due to the infections that you contract as opposed to the actual virus. So what we're aiming to do is, if you have contracted HIV, we want to get the right treatment to then nip it in the bud and come to a place of what we call U equals U. Or if it is that the infection or the load itself is so low,
Right.
that you are then unable to transmit it to someone else, and that is only done through treatment.
All right. So very good, Lee. So as the name says, if you really listen to the definition of HIV, human immunodeficiency virus, and it definitely speaks about the disruption of the CD4 cells, and this is something that we really have to try to understand. And as Lee nicely explained, the importance of our immune system, and this is why way back in the days, when the level of treatment that we have now was not present, many people who acquired HIV would have ultimately been diagnosed with AIDS and succumbed to this condition. With HIV, again, treatment is crucial, is very important, and early testing and discovery of HIV will allow the slow progression, and of course strengthening of the immune system with other means. But we can only find out our status if we test ourselves.
Right. So I want to ask, so we can give the public some knowledge. We talk about this testing. Most times you hear it and you know it, but besides, the labs, etc., we do have a unit that deals with these items, right?
Yes. So in Dominica, we have the HIV unit. Like I mentioned earlier in our program, we were supposed to have a representative, but unfortunately, we are not able to. But good morning to all the workers in this unit. We are very grateful to have you. And, I've been there before, and Jolly's has also partnered with the HIV unit a couple years ago. And I must say that they do a fantastic job in not just providing the services, but how they also disseminate information. So, good morning to all the workers in this unit, and also to Lester Guy, who was also supposed to be on with us. So, first things first, with the HIV unit, if you're wondering when can you go to have yourself tested, this week's especially is Monday to Thursday from 8:30 to 3 p.m. And the location, as I like to guide the individuals. So if you're going in between wholesale of Whitchurch and Western Union, just in between, there's a little alley section, and you cannot miss it. So once you reach around that area, you're not too certain, you just ask any one of the workers in those two institutions, and they can guide you. At this institution, like I just mentioned, consultation is also provided. So it's not just about walking in to the unit and say, I want to be tested, and they just draw your blood and they test you. So
And it's not just provided, it's mandatory as well.
yes.
And you'll understand the importance of that consultation as Jacinta continues.
Right. So when you go there, of course, because some people may not know their status, they probably are fearsome of the results. There is someone there to guide you through the process. So working with your necessary forms of ID, so passport, social security, and driver's license is all mandatory, or either one, I should say, is mandatory. And the consultation includes discussions of risk factors that increases the risk of one acquiring this condition. So, for example, let's say last nightly someone had sexual relations, probably the condom broke, but probably they had unprotected sex, and they're fearful that they may have acquired some type of sexually transmitted disease and or AIDS. So they go to the unit today, this morning, to be tested. However, even though they are to be tested today, it doesn't mean, well, you will not get an accurate reading, just because with the virus, it takes 3 months for it to show accurately if someone has been truly diagnosed with the virus in terms of the replication process, giving it enough time for the concentration to be at a level to be detected through the testing.
Mm-hmm.
So the consultation includes the risks. It also discusses the sexual history. So is it that you are just moving on to a new partner? What type of sexual activities do you engage in? So that will also give an idea as to the level of a risk that there is based on your sexual standing, activities, number of sexual partners as well, past records. Were you already diagnosed with other sexually transmitted diseases? And being diagnosed with other sexually transmitted diseases also increases your risk for HIV, which is a sexually transmitted disease in itself. So all of those discussions are important to educate us as the listening audience, and for you to have a better understanding as to why you will not get the most accurate response if you had recent sexual engagement less than 3 months and coming in to test. Now, the device used is similar to a pregnancy test, where you would either see one line which should indicate negative, or 2 lines which should indicate positive. Now, if it is the test brings 2 lines, then another test is immediately performed just to confirm the results. And if it is really 2 lines for the second time, then this person is immediately referred to a doctor, and they walk the person through the whole process in terms of treatment regimen, in terms of what to expect and guidance and so forth. So it's a unit where it's a holistic approach. And again, if the person is tested positive, then a full blood work is run, including pap smears. So for individuals who have gone there, who have tested positive, then an order is made where you have a full blood work done just to ensure that everything else may not be affected. And of course, if they do see, other indications for further testing, then definitely it will be done.
For sure, for sure. And this is so important because you have to understand that when we're going through HIV/AIDS testing, you are not just dropped off. You are not alone. You are not left with the results, whether it be positive, negative, whatever the case may be. You are not just left in the dark. So, in terms of us being afraid to test for fear of, right? And that keeps a lot of people from going to get tested, the fear of that result. It is so much better to know your status. Again, HIV is not a death sentence. It doesn't have to be if we indeed get ourselves the necessary knowledge, which we are trying to provide some of that today. But of course, the necessary knowledge, awareness, and of course, testing so that you know your status, right? So if you know your status, you then know how to move forward. Okay. And when we're talking about HIV/AIDS, it's important that if you are in a relationship, that you also encourage your partner to know their status as well. Now, we spoke about the incubation period, and it's a tricky thing because people often don't understand why they have to get retested, right? And you don't understand why sometimes that involves 3 tests. So you might have just an encounter, you get tested, they ask you to come back in about 6 weeks, and then they'll ask you to come back in 3 months. Now, with that particular regimen, what happens is that at that mark, it's a very smart virus. And when we talk about the medications or the treatments that we use a little later down, you'll understand why we have so much effort or why we have to place so much effort into treating the virus. So it's very smart. It replicates and it literally lives within you for the first, couple of weeks without your body identifying that it is there. And so most of the testing that might be available, depending on the type of test that it is, it looks for antibodies. Now, antibodies is what your body makes to fight the virus, right? So at this point, your body doesn't even know the virus is there, so it doesn't make any antibodies. So if you take that first test right after, so we're talking the next day, you take a test, it's negative. It doesn't necessarily mean that you have not contracted HIV. It could be that you contracted HIV a week ago. It could be that you contracted HIV last night. You could have contracted it anywhere in under about 3-6 weeks, right? Now, at the 6-week mark, your body would have then probably started to, display symptoms that it has acquired some type of virus, right? But it may take up to 6 months for an antibody test to be able to properly detect the antibody levels, right? So your body has just started making antibodies for it because it just identified that something is wrong. There's something I need to fight against. And so I create an antibody to fight against that particular thing. But the load or the amount that's in your body at that time at 6 weeks might still be too low for some tests to detect. So you take a 6-week test and it's negative and you say, I don't have that. You
don't bother go back.
You don't know. And at this point, it's so important that we be careful with our sexual activities, because having intercourse with someone you're not sure of their status and you think you might be affected, it's best for the idea of spread that we wait that full 6-month period, or we use barrier control, that is condoms. And that's the importance so much of condoms. We have them at the store coming. You can get them in different flavors, colors, sizes, whatever the case may be to fit your lifestyle. But it's important that we do not knock off condoms. And last week, just to sidetrack, last week we spoke about different types of contraceptives. And condoms are one of the few that actually protect you against STIs.
Definitely, Lee, because the other contraceptives they mainly aim to prevent pregnancy
right?
and not sexually transmitted diseases. So the morning after the microgynon, the whole list of them, the injection, the inserts as well.
Mhm.
All of those, yes, they work very well to protect against pregnancy, but the condom is the one that has that physical barrier. So you get a two-in-one.
Right. And then when we say it like this, right now the society is focused so much at
Preventing pregnancy.
contraception,
Mhm.
and whether it may be that you're not ready, or if it is financial constraints, or you don't want any lifestyle changes, or maybe you don't want children. So we're so focused on pregnancy that we have forgotten STIs, but STIs are just as important. So to get back on track, right, you've taken the second test at that 6-week mark. Now your antibody levels are so low in what your body has created that the test still comes out negative. At 6 months, by this point, although the virus is very smart, your body would have detected it. Your body would have produced antibodies against it, which are of a high count enough that a test, most all tests at 6 months, will be able to tell you or detect antibodies for HIV within your blood, right? And at that point, it's indefinite that we have this virus. Now there are other tests that test for not the antibodies but the virus itself. These are tests that are available on the market, but more than likely with the rapid test, you might get the ones that do the antibodies. So it's important that you listen to the counseling from the nurse or the doctor, and you listen to the testing schedule and you adhere to that, so that you can truly know where you are in terms of your HIV status.
Right. So, Lee, an interesting fact is that many people have the misconception that an individual doesn't look sick.
Mhm.
There are no physical symptoms of one being sick. And so, with that, they are, negligent of the fact that you do not have to have any physical symptoms to be diagnosed with HIV. And I think a lot of us have that misconception, and unfortunately, it prevents or clouds our judgments in partaking in safe sexual relations. Unfortunately, again, some individuals may lie and say, okay, yes, I got tested recently, I'm negative. But word of mouth is not sufficient. So this is why when you are getting tested, whether it's at the HIV unit or any other testing facilities, you have Triage, Lafayette, and the list goes on, you get a paper that gives your status. Okay, so confirming whether or not you have HIV and not just going based on looks is very important. I forgot to mention that in the HIV unit, in the consultation, they also ask questions about your drug use, and as well, especially alcohol, because we know that alcohol can cloud our judgment. And if someone drinks regularly, they're partying consistently, or partaking in other types of drugs that may hinder proper judgment, then they may fall prey to having conspicuous or unsafe sexual relations, which can of course increase the risk of STDs, including HIV and AIDS. So, like I said, it's a very thorough approach that happens at the HIV unit, and so we have to be grateful for that. Lee, you mentioned initially when someone has gotten the virus that the immune system starts to fight. And what you may notice is that many people will come down with the flu. So you get medication for the flu, the coughing, sneezing, you may feel a bit weak, a bit thirsty, nauseated, and the whole list of possible flu symptoms. And most times we may not think to ourselves, oh gosh, I may have acquired a sexually transmitted disease. So again, because our immune system is under attack, the symptoms of HIV will mimic those of flu symptoms. So, again, the only way that you will know for sure that you are negative or positive is to be testing. So, what we're going to do right now is just take a break. When we return, we will speak about the types of treatment that is available and how they are prescribed and taken.
Introducing Johnny's Pharmacy, brand new website, www.johnny's.gm. It's your time to jump the line. Shop now at johnny's.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Johnny's.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.johnny's.gm. Johnny's Pharmacy, leading the way in healthcare. Wake up this morning feeling distinct. I had the intentions to call it sick, but I end up in Jolly's Pharmacy. Red and down to the street, Jolly's fix up my immune system. Me feeling fit and strong, now I'm ready to work like it's on any mission. If you see me forget, Jolly's Pharmacy is number one, Jolly's forget. We cater for everyone, Jolly's forget. Fix up the immune system, Jolly's forget. Yo, Dominic, it's about the box. Whenever I'm in town and I'm feeling down, I head to Johnny's Pharmacy. They boost me up real quick. Johnny's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience will make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. If you're not happy with your social, get that to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. Get that to everyone. What a happy place. Oh, what a happy place. But just take some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fonfole where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
So welcome back. If you're now tuning into the big station, you are listening to Leona and myself, Jacinta, from Joy's Pharmacy, the program Health Vibes. So we said we have gone through different segments already. I think we have.
Just want to say a special good morning again. Again, if you're tuning in to Julie Polidor, of course, you're here every week and we are grateful for that. So happy Wednesday. Blessings to you all as well. Be sure to tune in online with us. If you also want to call in or ask any questions before we continue, because we are going into the meat of the matter right now. Before we continue, you can call 449-3095, 449-3096, 449-3097, and 616-4257. For those of us who may be overseas and would like to add into, the meaningful convo of HIV/AIDS awareness, you can call 305-432-9624.
Right. So you are free to call in. I know some of you may have questions about HIV/AIDS. You may know of someone who was recently diagnosed and you want to get a little more information. And if you have been recently diagnosed with HIV, as Leona stated, it is not a death sentence. Fortunately, right now we are in the era where there are many treatments available, and even more, as we speak, are in the pipeline being tested, formulated, discussed. So, as time progresses and as we have more technology on the tips of our fingers, then, we have a better chance at survival and combating this virus.
Indeed.
Yes. So World AIDS Day on the 1st of December, and the theme, as we're speaking about, is overcoming disruption, transforming the AIDS response. So right now we're going to speak about how HIV is transmitted. So again, there are myths about how HIV is transmitted. Some may say, okay, if you hug someone with HIV, if you kiss someone with HIV AIDS, if you are close in range, or through other physical means, not sexually, that you can get HIV. But this is incorrect. This is inaccurate. So HIV is a sexually transmitted disease, and so it is transmitted through bodily fluids, including blood, semen, pre-seminal fluids, so that's precum, layman terms, vaginal fluids, rectal fluids, and breast milk. So HIV can be transmitted through these types of fluids, either through sharing of needles, engaging in sexual activities, and again, it can also be transmitted through oral sex. This is also a myth that many people believe that, okay, if they engage in oral sex, that they will not acquire HIV/AIDS. So while the risk is lower through oral sex, you can still acquire HIV through oral sex. If you are engaging in activities, sharing needles, remember needles, you inject yourself. While yes, you are injecting yourself with different compounds, drugs, sometimes blood is also taken up by the needle. And if you are sharing needles, then of course some blood can be injected into another individual, and hence the virus will spread from that person to the other person. So, like I mentioned, there's vaginal sex, anal sex, oral sex, other types of bodily fluids that can be passed on. Now, when an infant gets HIV during pregnancy, childbirth, or breastfeeding, it is called perinatal transmission of HIV. Now, with this case, if the doctors, through thorough testing, realizes that a pregnant woman has HIV, of course, they will do their best to treat that mother safely, for both she and her child. And again, the aim is to reduce the viral load so that that child has a higher fighting chance, and the mother as well, to slow the progression to AIDS. So I'm hoping that, we have a clearer understanding as to how HIV is being transmitted. So if you share personal items that may have blood on them, so we spoke about the needles or even razors, sometimes, sadly, toothbrushes. I don't know why we would resort to sharing toothbrushes. That's a big no-no. But any device or equipment or tool that can possibly transmit bodily fluids or blood from one person to the other is a means of transmission. Okay, so those are some of the main ways. Some people may say, okay, what about mosquitoes? We've had many cases of dengue recently, but no, it has been confirmed that mosquitoes do not spread HIV from one person to the next.
Right. So that is about a lot in terms of transmission, right? So let's go into the area of now treatment. Now, like we said before, it's a virus, right? So misconceptions. It cannot be treated with anything but viral, medications. So you cannot have HIV. And that's the thing. Sometimes when you get HIV, when you just transmit it, you may have, like Jacinta said, the flu symptoms, right? So you may notice, night sweats, a general feeling of malaise, you might be in pain. And at this point, you think, maybe if because some people are also, I mean, it's almost like the 5 stages of grief. So it may be that you're in denial, or it is that you think it can be a quick fix. So at that point, if you figure I can get some antibiotics and maybe the initial symptoms go away in terms of, and that doesn't have anything to do with the drugs at all. But at that point, you feel like this is a one and done. Unfortunately, because HIV is indeed a virus, it remains in your system. It does not leave. And at this point, we have no cure. So what it is the viral load goes down so very low that it's undetectable. And at that point, you cannot transmit it, but it's always there, which means we always have to be on medications to keep that viral load suppressed, right? So the medications that you'll hear when we talk about HIV and AIDS meds are ARVs, or antiretroviral medications. So there's antivirals for things such as the flu and other things, but these are specific types of drugs which are pretty well controlled and kept, kept at specific locations on island, actually,
Right.
in terms of dispensing these medications, because these are things you need to go through the proper process, consultation, the proper identification, the lab testing, confirmation, all of these things, and through specific doctors that can prescribe this medication to you. And you get the medication. Mainly you can get it at the Roseau Health Center, which is where most of the bulk of it is stored. Or if it is that you have an emergent situation, and I'll talk about why that's so important, but an emergent situation, take yourself to the casualty, the health center, where they can then refer you as to what it is you need to do. So when it comes to antiretrovirals, the combination is often the treatment, I should say, is often combination based or combination treatment, and that is the standard care. So you get multiple different drugs sometimes in one pill, and it may seem overwhelming because sometimes you have 2-3 different drugs in a pill and you still have another pill to take. Some of these drugs, you take one tablet twice a day, some of them are once a day, which obviously once a day is easier to adhere to. However, it's important that you understand that the regimen they put you on, whether or not it may be 4 different drugs, it is essential. And it is something that you have to take as directed. Why, you may ask, that we need this many medications to treat HIV? Again, is very smart and it's very difficult to treat, and it's replicating, within your body. And we say replicating, we're talking about on a DNA level, right? And so usually these combinations are given to avoid the quick mutation of HIV. So if we're using only one drug alone, that can lead to resistance to those drugs pretty quickly, right? So the combination therapy is used to then, if you think about it in layman terms, almost confuse the virus, and the combined drugs that hits the virus at multiple different times in their cycle or their life cycle. So some of them greatly reduce the chance of resistance when they're combined. And of course, that achieves stronger viral suppression and better clinical outcomes. So some of the main drug classes, and I won't go too much into the classes because, at this point, the information that we need is the basic, right? But these drug classes work in different ways. So it might block HIV from replicating. It might block some of the different enzymes that cause HIV to thrive. It might also block different binding sites so that the virus cannot adhere to those CD4 cells, all of these things. And that is how it works in terms of stopping attachment or them entering the CD4 cells. We have a caller on the line. Let's just take that caller. Caller, good day.
Hey, good morning.
Good morning.
Good morning.
And, Leona.
Yes,
Okay, and I'll say good morning to also to Trudy. I guess she must be listening.
indeed.
Okay. Yeah, early on in the program, when you were talking about HIV and infection, and maybe you could have intercourse and go on the test and not see anything, and you'd have to wait a 6-month period.
Uh-huh.
In that timing or within that time, there would be other signs, like something like, okay, the person might not be seeing or maybe not paying attention, but if your body is under that kind of attack, you would have something that would trigger there within your system, your lymph nodes.
You would have
Wouldn't that
sorry?
be your lymphatic system, your lymph nodes? Because once your body is going through any attack, the first sign would be your lymphatic system giving you a sign. Your lymph nodes, you would feel something going wrong. And that would be an indicator that something, the body is fighting a virus or something. It may be even before you reach the point where that the test would show positive. Your body would be telling you, giving you some kind of signals through your lymphatic system. Wouldn't that be true? Because your lymphatic system is directly related to your immune system, or vice versa.
Yes.
And once the body is fighting an infection, the lymph nodes are your guide, they will give you some kind of indication.
That is indeed true. And it
Uh-huh.
is that you might have an immune response. But like we said earlier as well, it may be something as simple as cold and flu symptoms. So you might develop night sweats, you might develop, maybe even a fever. You might be generally sick and all of these things. But there is no way at that point, unless you are sure that you've had intercourse with
You can,
somebody who is
yes, I
positive,
get.
that you might
Yeah.
know.
Yeah, but I
So
just wanted to inject that part where, I mean, for the individual or just for knowledge out there, because
Mhm.
somebody can have their lymph nodes kind of inflamed and not understanding why this, okay, why you feel glands under your neck or you feel
right.
things
Mhm.
and maybe just ignore it.
Mhm.
And what I want to put out there is when you feel something like that, if your body experiences some kind of infection, so you need to go check yourself.
Right.
That's
Right.
really what I want to put out there. Because a lot of times we talk about all the immune system, but we live in a lymphatic system, which is directly interrelated to the immune system. Just
Mhm.
wanted to drop that in there.
Thank you,
So
caller.
have
Thank
a
you,
good
caller.
one. All else.
Thank
Nice.
you.
Same to you. And you're right. In terms of that's one of the symptoms that you might experience as well with an acute infection. When we say acute, we mean during the first 2 to 4 weeks of contracting the virus. You may experience swollen lymph nodes, which are often a telltale sign, and we often use to note if we are unwell or if we have some form of infection that we are fighting. So that's definitely something that is beneficial. The only thing is that because it is such common symptoms, you may overlook it. But if you do know that you've been involved in some form of some sexual activity, or if it is a new partner and you're not sure of your status, sometimes we have unfortunate situations where sexual assault is involved as well.
Yes.
And that is something,
Mhm.
if you have been sexually assaulted, right? If you have been sexually assaulted, unfortunately so, it is important that you go to a medical professional. I know that sometimes with assaults and trauma, it keeps us away from these avenues.
Mhm.
But it's important that you go because, and we'll go into that, one of the treatments available if you have been assaulted and the status of the assailant is positive, or they don't know, one of the treatments that are available can actually be given after transmission and prevent you from acquiring HIV. Now, that is very time sensitive. So it's something that has to be given as early as possible within 72 hours of exposure.
Mhm. Mhm.
And I think it's such an amazing treatment because you could have contracted the virus from this assailant.
Yes.
And with giving we've given this medication within 72 hours, it blocks the ability of this virus to then replicate and attach to your cells and stay in your body. And so you are now protected. That's something that you usually take for a month. You're now protected and you do not contract the HIV virus. So that is something that we need to know so well. So if you are in a situation, like such as those that you need that treatment or intervention, definitely get yourself to the unit, get yourself to the casualty, to the
Mhm.
health center, to a doctor who can then direct you to the specified doctors who deal with that and future treatment.
Right. Rightly so, Leona. I think that's a very important note because unfortunately we do have cases where individuals have been assaulted, and giving them that information, gives them a greater fighting chance. So I think this was very important information that you just shared with us. I want to go back to the caller. In the relation to the lymphatic nodes and our immune system. Now, during that period of waiting, even though we were to experience those type of symptoms, so the flu-like symptoms and night sweats and those of the likes, it doesn't necessarily mean that it is caused by the HIV virus. Now, we as human beings, our mind is very powerful. So throughout that waiting phase, just the anxiety of it, we may be stressed out. We may not be eating properly. There are other factors in our lives that can negatively affect our immune system. So while yes, our nodes, our glands will give an indication when our body is fighting off certain types of infections, it may not necessarily mean that it is caused by the by the HIV virus. So just keep that in mind. But I do want to stress on the point that if your body is presenting, those type of symptoms that are unusual, to still, have yourself checked out. So Lee, back to our discussion about the prophylaxis. So the retroviral medications that are given to individuals who have been diagnosed with HIV. So the options include both pills and injections. With the injections, the frequency would be less. So fortunately, there are options where once a day dosing for the tablets are available, and that increases compliance levels. And like you rightfully said, it is of paramount importance that a patient takes the medications as well every day on schedule to keep the load or the concentration of the virus very low. Before we even came on this morning, you spoke about the UU, where it's called undetectable equals untransmissible. And this is where the concentration of the virus is so low that it is undetected. And there have been situations or couples where one of the partners, one partner was diagnosed with HIV, but because they are on HIV treatment, they are taking it as they're supposed to, and the concentration is so low, it means that it is undetected, which means they are able to conceive, right? And under guidance, of their doctor and other health professionals. So those are options available, the types of treatments available. But again, this cannot reach this level if a patient is non-compliant, if they do not follow through the guidelines of their doctors and have their follow-up appointments where they receive their treatment on time. Okay, so all in all, medications are there to help us fight off infections, in this case viruses, and so antibiotics will not have a place in fighting off viral infections, and that's very important. And just one side note, because we do have customers coming in saying they have the flu, so they would like some antibiotics. No, the antibiotics will not help with the common flu unless if a tertiary or secondary infection arises, that may be bacterial, and so that's where antibiotics would come in.
Right. So many treatments out there. I think right now what we have on island may be more so in terms of oral medication.
Yes.
But it's never too far-fetched. You can always ask your doctor if you are indeed someone who is on HIV medication or needs to be put on this medication. You can have thorough conversations with your doctor as to what is best for you. And adherence, of course, is important simply because we also have resistance. So if you're not taking your meds as you should on time, a treatment that was then keeping your viral load low no longer works and is no longer effective to the virus in your body. And of course, we can keep switching treatments, but if it is that you're not adhering to those regimens, then at that point, your particular situation or your particular viral mutation might be very difficult to treat. And that is where we are getting into the likelihood of more so developing AIDS, which is where we want to try to nip the bud, right? So in terms of treatment, we spoke about something called PEP. So that is post-exposure prophylaxis. And so it's a way of avoiding a person from contracting HIV after they have been exposed to HIV. And that would be the tablet that I spoke about that you would be given for a month, about 28 days, that you have to take on time and daily. And of course, no further exposures occur within that time. So it is that if you are exposed to someone that you do not know their status, a situation where possibly, and of course that's a big case by case basis because it's something that is not just given out. It has to
Yes,
have,
exactly.
reason for this, and the doctor has to decide. So, for instance, we have a lot of persons who work in healthcare, and we have, the needle pricks, needle sticks, or if, for instance, your gloves have been broken, you had a cut, you're exposed to blood or any fluids. So, nurses, doctors, pharmacists, we are all at risk in that regard. So, if it is that you have a situation that the doctor deems that you need post-exposure prophylaxis for, you are given these pills for 28 days within the 72-hour period of being exposed. And of course, it acts almost like a fire extinguisher in terms of HIV and prevent you from contracting. Now, there's something called pre-exposure prophylaxis, or PrEP. So a lot of times you hear PrEP and PEP, and we're not sure what it's for, but PrEP is pre-exposure prophylaxis, and these are drugs that are given before exposure to prevent HIV. It sounds counterintuitive, but we have persons who are in situations where they are at higher risk. So that is for persons that have ongoing risk. It's not something that's given temporarily. It's something that you have ongoing risk. So if there is someone who has multiple partners, and of course, the more partners that you have sexually, the more at risk you are. So multiple partners, persons who do not consistently, use condoms in that regard as well. Persons in relationships with partners living with HIV, as well as, persons with frequent STIs. So you're already one way or the other immunocompromised in that regard. Persons, because we do have all of these things in our society, persons who inject drugs, they are also high at risk. And of course, persons living with the high viral load or untreated HIV. And so PrEP works by taking daily medication, and it builds up the protective levels in your blood, your rectal tissue, and your vaginal tissue, and that blocks HIV from replicating if exposure happens. So if you have a partner, it's not that, and that's why we say life continues.
Yes.
You can have HIV, you can still have sexual relations, you can be married, you can have a family, you can still have a partner, your children can be HIV free if you take your medication properly. And so that begins about
Just
want to
I
interject?
yes, I wanted to just state there because our listening audience may have this perception that okay, when I want to have unprotected sex, and
Right.
they can just walk in to the pharmacy
Definitely not.
and request PrEP.
Definitely not.
And no, it does not work this way. Like Leona stated, it's a case-to-case basis. So it's not just a matter of okay, well, I don't want to get AIDS ever, and so I just want to acquire those type of antiviral medications to prevent any
No.
possible, acquiring of this virus. But it doesn't work this way.
What you can acquire are barrier protection.
Yes.
You can get your condoms, and it's up to every individual to protect themselves. I cannot expect my partner to protect me if I'm not protecting myself. You understand? And right now, in our society and in our culture, we know there's a lot of different practices. And so in order to get yourself optimal protection from STIs, you need to invest then in protecting yourself in some condoms or, other barrier methods that work in terms of protecting you against STIs. Now, PrEP or pre-exposure is like a seatbelt. It helps to keep you in check if you are at higher risk. You understand? And higher risk is not determined by yourself. It has to be determined by your doctor. So if you're in a relationship with somebody who has HIV, you are at high risk. If you have multiple partners, you're at high risk, but you're not necessarily going to be prescribed, antiretrovirals. So it's up to you to then protect yourself and your multiple partners, right? So this is what it is. And so PEP is used before post-exposure or after exposure in specific situations, and PrEP is used before exposure. And when we come into, we talked a lot about childbirth, but maybe we should expound a little bit. If you're on your medications, because we have males and females who have HIV or HIV in Dominica specifically. And so once you're adhering to your medications, it can be that your child is born without any trace of HIV whatsoever, right? So when we have children being born with HIV, for one reason or the other, a medication either was not being taken at the time or it was not effective, right? But it can be that you're steady on medication and you still have children and you protect them from contracting the virus. So it's very possible to then continue with life as usual.
Right. So definitely. So being up to date with the types of medications available to you in whatever country that you are, and knowing what your status is will determine if you need any treatment and the type of treatment available. Like your regular medication that you take for blood pressure, for blood sugar, for cholesterol, this type of medication is just even more important. And if you want to live that healthy life, um, taking your medication or being very compliant is very important. Another thing, Leona, is that sometimes people fear that other people may see them going to the HIV unit or going to other testing facilities because of that stigma. She thinks she thinks she has AIDS, or he thinks he has AIDS, or he's been or they have been engaging in risky sexual activity. No, knowing your status is key, and if we have to be making choices or decisions based on what people think about us when it comes to our health, then we are putting ourselves back, and we are also avoiding getting properly diagnosed and being treated.
Definitely. And there's a lot of ways that you can mitigate the stigma, because we cannot ignore the fact that there is a stigma. And we cannot ignore the fact that naturally, acquiring HIV is a big thing. It is or can be, I should say, mentally and psychologically taxing. And so it's important that we identify different ways to then adhere to your medication without the fear or the constant anxiety where stigma is concerned. Of course, one of the ways that you can do that, I know that some of the doctors and even the counselors who deal with HIV patients opt to pick up the medication for them, right? So that is one of the aspects or the avenues that you can try to use. Instead of not taking the medication at all, ask your doctor if it is that they can pick up the medication for you and you can get it from them. You can also ask a family member, a friend, whatever it is, to pick up the medication. There's a lot of ways to mitigate, the stigma. And of course, if you go for it yourself, it's still not that anybody knows what you are going for. In any clinic setting, you have some sense of privacy or level of privacy with your medication. And of course, when it comes to HIV, it's not that your name is on a drug for that particular reason or anything like that. The identities of the patients involved are very well protected, right? And so there are systems that are used to then be able to only identify patients to the persons, who are dealing with these medications, or the persons who are part of that process, like the doctors who would then be able to prescribe to you. And so a normal common man would not know who this medication is for, regardless of seeing the meds or the drugs or anything like that. So there's a lot of things that are put in place to avoid the stigma and avoid having your medical information out there. And so these are some of the avenues that you can use. One of the things that's important to say is that right now, in terms of HIV and AIDS, there are about 40.8 million people living with HIV worldwide, and that was from a 2024 study that was done UNAIDS and the World Health Organization in 2024. And so that's quite a large amount of people. So you are not alone. There are a lot of avenues that you can go to anonymously to have camaraderie or to speak about what it is that you're going through. There are a lot of counselors who are well versed with the topic of HIV and AIDS. And of course, with any form of counseling or any form of healthcare, we are, under oath to keep these things private. And of course, you have that confidence that your medical records are also kept private. So these are things that you can discuss. If you're coming to the pharmacy and you're on medication and you are immunocompromised, and that's what we term it most times, and you do have HIV or AIDS and you're not sure if it is, that you can take something, you're feeling some type of way, you can have a counseling session with us as well. We have a consultation room for stuff like this. And of course, we can help you in any way. If you're afraid to get to the unit, you can come in like we can help you in any way to point you in the direction that you need to go in. So with this many people, we have about 1.3 million new infections. That's what we had in 2024, right? Now, with HIV, the better we are in terms of treating it, and we're going back to the theme, those obstacles that help with treating it. Right now, HIV treatment is free, right? And it's offered by through the government system, and it is free. So if you're contracting HIV, we probably have no clue as to what the medication costs, because you can get this medication for free. Take advantage of that. If you do need HIV medication, take advantage of that free offering and get the medication that you need. And so what we want to see by 2030 globally is a drop, in those new infections, because persons with the infection, or with the virus, I should say, are taking so much of good care of their situation that it's not transmitted, right?
Exactly.
And then we have persons living healthy, happy lives as well, who have the virus, and you are healthier because of adherence. We have persons who are taking their medication and they're having safe and healthy childbirth, and so they're not transmitting. And that gets us closer to the goal of having AIDS not being a public health risk. And funny, if you notice, it says AIDS and not HIV. So persons will still be living with HIV.
Right.
If you've contracted it already, you're living with it, and by 2030, if God spares and we're still all here, then it is that we still have HIV. But
Right.
what we want to prevent against is the worsening of that HIV into the area of AIDS, where you then have to be, on different other medications, where you're then immunocompromised, where you're then getting sick all the time. Your other bodily systems are being affected, because if you have HIV and you're taking meds, you feel exactly, you feel normal. You feel perfectly normal in terms of your bodily systems. You are not sick. And that is what we want to avoid, right?
So all of what Lee has just graciously informed us says that we have treatment available. There is no reason why we should allow ourselves to fall prey and to suffer the complications that can arise without treatment when you have been diagnosed with HIV. You can live a normal, healthy life with compliance, with regular follow-ups, and being honest with yourself and your loved ones. Now, if someone has reached the level of undetectable, HIV, you still have the responsibility to disclose this information to your partner, right? Because they have the right to know. They have the right to know. So in whether or not you can transmit this virus to another person, it is still the person's right to know that you have this virus. Again, education is key, communication is key. Right. So I just want to stress on another area that just like, well, not just like the flu, but similarly with other viral infections, because with HIV as well, where your immune system is compromised, it is your responsibility to try to strengthen it as much as possible. So what do we mean by that? It means eating healthily. So with the immune system being at a risk, or you're being more susceptible to acquiring other viruses, other infections, and you suffering at a greater rate or level than someone whose immune system is stronger, then now you have to more than ever try ways to strengthen your immune system. So eating healthier, physical activity, refraining from improper use or overuse of drugs, including alcohol, steering away or trying to look at ways to better manage your stress, because stress on its own can put stress on your immune system. So you try your best to work with your immune system, strengthening it as much as possible, giving yourself a better fighting chance at a healthier life. Okay, so there is a lot to think of as you are now at that level where your immune system is asking for assistance.
Right. And to congratulate us as a country, typically from the the most recent information from PAHO and the World Health Organization, Dominica has achieved the elimination of mother-to-child transmission
Very good.
of HIV and syphilis at the time as well, which means that we are indeed doing what we need to do, mothers, and congratulations to you for avoiding transmission to our children. We have a caller. Good day, caller.
Good morning, caller. Can you hear us?
Hey, good morning, Jacinta again,
Hi.
Leona. Yeah, Jessica just said something there about building the immune system, and also she adds to it exercise. A lot of people might just be eating right and not exercising. And exercising is a key part of building the immune system
Of
because
course.
it's causing things to move around,
Right.
building up the heart rate and causing the blood. In other words, it's building up on circulation
Exactly.
when you exercise. And a lot of people not taking that part of it. I know people who eat right and they just don't exercise. And I'm really glad you emphasized that point. And I want you to re-emphasize it because most times people just think eating right and that's it. But if you're eating right and you're not moving around, you're not exercising, then you're missing out on a whole greater part of distributing all that good food that you're eating,
Indeed.
So
Yes,
I
you are
think
correct.
exercise, exercise is key, and you have to move things around because you have to keep the whole system pumping. You have to keep the blood to go down to the foot and come back up to the calves and keep the body running. And that's the only way you're going to move things around because things can get settled in an area and cause problems if you're not exercising, but you're eating right.
Yes.
Just want to interject that. Have a good
Wonderful.
one.
Thank you. And that's right. And movement is important for so many things. But like you said, and that's important to note, when you get the nutrition into your body, it is transported to all of your organs and your tissues through your blood. If you are not moving, you're affecting that process. So in terms of movement, you're helping your heart to pump that blood around. You're helping to strengthen your heart to move the blood around the body. So if it is that we're underactive, most times when you're underactive, you start to develop, fat and weight, skin, and all of these things. It makes it more difficult for your body to then distribute the blood with all of those nutrients around the body. And so that's very important that when we talk about health, we usually talk about food.
Right.
We usually talk about movement.
Right, because everything goes hand in hand, and like Leona mentioned, and our caller, exercise brings many health benefits. So you have the absorption process that's been strengthened, your digestion process, your circulation process.
Right.
So you have all the nutrients and oxygen circulating throughout your body, and if you are not assisting your body in circulating the necessary nutrients throughout the body or medications, then you are at a loss. So yes, physical activity is very important. Managing your stress levels are important. Eating healthily is important. The whole works of it, and we mentioned very briefly about the counseling aspect where the mental health aspect of it comes into play. And that's why I will always give Lester his kudos for what he does as a consultant and a counselor as well, who also has great experience with individuals who have been diagnosed with HIV and other aspects of life in counseling, in guiding them, in making sure that they have that support system as well. So Lester guy, if you're listening, good morning, special good morning to you. And we are just want to recap because our time has narrowed down with such great information that we have disseminated this morning. So all in all, we are recapping about HIV, human immunodeficiency virus, and AIDS, autoimmune deficiency syndrome, where HIV can be treated, and the viral load, mean the concentration of the virus in the body, can be kept at a very low concentration, where the progression is slowed down so that it does not progress to AIDS. And living with AIDS or living with HIV, you can live a healthy, happy life. So today we spoke about safe sexual options, so which means using condoms as a barrier, getting tested, limiting your sexual partners, avoiding the use of drugs, other alcohol, or any other type of means that's going to compromise your judgment. And when we are having fun partying, try to keep your head leveled or have friends or people around you, there to give that extra support if for some reason you may fall prey to the effects of alcohol or other factors around you.
Right. And to continue with some of the myths and facts about HIV/AIDS, we want to know that HIV/AIDS can only be contracted or it can only be transmitted through bodily fluids such as semen. We're talking about blood. It can be transmitted through oral sex. It's lower than vaginal sex, but it can be transmitted through oral sex, through rectal as well. It cannot be transmitted through saliva. It cannot be transmitted. So you cannot kiss someone and get HIV. You cannot hug someone or shake hands and get HIV. Sharing toilets does not give you HIV. All of these things. We're talking about those deep bodily fluids that can then transmit it. So it cannot be spread through casual contact. Mosquitoes, however, they suck our blood, and yes, they have a minute amount of blood in them, but they cannot spread HIV. That is at this present time impossible. HIV is not a death sentence, not anymore anyway. Early treatment can give you a near normal or if not normal lifespan. It does not have to also go from HIV to AIDS if you are properly on medication. You can stay in the HIV region if you've already contracted HIV and not get into the area of AIDS. Right now, I have a question here where someone asked, without being tested, what symptoms can notice if you have AIDS? I will say there's a myth that you can see HIV in someone. This is not true. So you can only confirm HIV and AIDS through testing, right? And with the confirmation of HIV and AIDS, then you can do what needs to be done. Now, when we talk about AIDS symptoms will differ from HIV. When you have fully blown acquired immunodeficiency virus, and that is where we talk about the viral load of the HIV being so high that it gets to the point where your immune system is basically non-existent or it's no longer effective at all. At that point, you may notice yourself being sick more often. You may be more susceptible to common infections such as pneumonia, meningitis, all of these things. You may more likely develop these symptoms. You might notice stuff like weight loss. You might notice fatigue, a general feeling of malaise all the time. You may have more hospital visits, all of those things that come through. And of course, with the breaking down of your immune system, depending on what you acquire, you may have some organs that are affected as well because of that. But again, all of these things I just said can come with other conditions and diseases, which is why you need to test. There is no way to know. A person loses weight, they could have a thyroid issue.
Yes.
They could be exercising, they could have HIV, they could have some metabolic issue. So there is really no way to know what causes these things, right? Now, one of the things that I don't think we talked about, HIV can survive outside of the body. The fact is, the HIV virus dies very quickly when exposed to air. Right? So it's not that you can have, you drink from a cup and I drink from it as well, and I contract, HIV if you are HIV positive. That is indeed a myth. Now, the fact is, anyone can, and that's why it's important that we talked about this today. Anyone can contract HIV. HIV is only dependent on exposure, not your identity, not male versus female, not children versus adult or elderly. Anybody can contract HIV. And HIV is not or no longer should be looked at something that is only a lot of people will say it's your life choices. It's what you did or it's how you decided to live. No, HIV is a condition just like diabetes or hypertension that unfortunately you might acquire. And so at this point, it is up to all of us to then break the stigma and understand how HIV comes about, what it is, how it's treated, how it can be transmitted, so that we can live up to the 2030 goal. And as a country, I think we're doing pretty well. So I want us to continue doing pretty well, that we can live up to the global 2030 goal of eradicating AIDS as a public health issue.
Well said. So this has been Health Vibes. We truly thank you for joining us today. For our regular listeners and viewers, we appreciate you. And we join we're looking forward to you joining us for another Vibes next week, Wednesday, same time, same station. So thank you so very much. We pray that the information given was very clear. It clarified any myths, any misconceptions, and so we are truly grateful to have that opportunity to share information with you. So we are signing out. Enjoy the rest of the day. And take
Indeed,
care.
indeed. Enjoy the week, enjoy the day, and pass on the information to anyone
Yes.
that you can. And of course, if you know anyone who may be living with HIV/AIDS, offer some form of support, offer awareness to your coworkers, your children, especially, those of us who are sexually active, that we take hold and take charge of this, our bodies and STI contraction. And of course, thank you again for tuning in to Health Vibes.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Each and every Wednesday,